We may be living through a pandemic, but at least you don't have to worry about being evicted in the middle of it.
Nobody in this community is alone.
If you live in Multnomah County and you can prove you need the help. And we learned that the best way to fight back against the virus is to isolate ourselves and test for it. And if you're wondering why Oregon is so behind on testing, don't feel too bad. Most of our leaders, they aren't sure either, though that might make you feel worse. And we have a very important favor to ask you on this very, very weird St. Patrick's Day. Here's the story.
Hey, how's it going, everybody? I'm Dan Haggerty. This is the story. Now, before we get started, did you wash your hands? It's okay. Go ahead. We'll wait. Take a minute. While you're scrubbing down, start thinking of some of the questions you want to ask us using the hashtag HeyDan, or you can reach out on email or Facebook or Instagram. They don't have to be coronavirus questions. That's okay. We'll talk about other stuff, though. I'm probably thinking that's the only thing on your mind right now. Just like we always do, we're going to try to make sense of this together. All right? Okay, it's been about 20 seconds. I clocked it. Turn off the water. Let's get started. The question is, where do we get started tonight? How about with all of the announcements from practically every single level of government today? I think the mayor, the governor, and the president were all on the TV around the same time this morning, which just might be a sense of the new normal around here. And they announced some pretty substantial changes. So let's start with small government. We're going to work our way up to the feds. Today, Multnomah County announced a moratorium on evictions, so you can't be evicted. But there are some conditions we have to tell you about. It only applies to people who have lost their jobs, lost work hours, or have to miss work to take care of kids. It also applies as long as the county is in a state of emergency. And Mayor Wheeler stressed, don't forget about the first of the month.
Keep in mind, rent owed to any landlord will continue to accrue. This is not a forgiveness of rent. But what it does is it buys you more time that you wouldn't ordinarily have.
As for the state, about an hour ago, Governor Brown announced schools will now be shut down until at least April 28th. And then this morning, she also announced a ban on visiting long-term care facilities, adult foster homes, and group homes. She also said the federal unemployment database was overwhelmed, and rural Eastern Oregon is facing some unique challenges of their own.
It doesn't feel real in Eastern Oregon, and that we are struggling to communicate the importance of social distancing measures there. And they also have some different challenges. We have very limited hospital capacity there. And the other piece is, honestly, we just don't have the personnel.
And for the feds, today the Trump administration said it supported a proposed $850 billion stimulus, which could include just cutting every single person a check.
You have people that work on tips. You have people it's a large number of people. It's a tremendous, who would think this, right? And they do nicely. They work very hard, but they work on tips. We have to take care of our people. We don't want to have people suffering during this period. It wasn't their fault that this thing all of a sudden was upon us.
Again, these press conferences, I wish they'd just stand a little further away from each other, 6 feet minimum. You see, they isolate me in here completely. Nobody will even come near me. Social distancing, people, it's important. For our big story tonight, I'd like to talk about testing, why it's so important, and why Oregon is so far behind. Now, first of all, I want to remind you that the first U.S. case was found 150 miles from here. You'd think we'd be more on top of our game at this point, but instead, we're behind. We're behind Washington and California and a lot of others. According to the COVID tracking project, we haven't tested as many people as New York, Colorado, Florida, Illinois, or Minnesota. In our state of more than 4 million people, we've tested about 1,000 of them. Just today, Oregon announced 18 new cases, bringing our total to 65 positive tests. But what do those numbers even mean? I mean, I did okay in statistics class, but I'm just not getting it. You've seen those memes about West Virginia being the only state without COVID-19. Now, do you think that that's because no one is sick there, or because as of yesterday, they'd only tested about 40 people? West Virginia got its first confirmed case today, by the way, so it is now in all 50 states. Bottom line, sick people in our state, people with fevers and with coughs, can't get tested, and no one seems to know why. Last night, I sent this email to every single member of Oregon's legislature. That's 60 representatives and 30 senators. I asked them all the same 3 straightforward questions. Why is Oregon so behind on testing? When are we getting more tests? And if you don't know, what are you doing to find out? So far, I've heard back from about half of them. Most of the responses directed me to other people, and no one could answer the first two questions. Now, Governor Brown seemed angry this week by a lack of help from the federal government, which is also way behind some other countries when it comes to testing. But clearly, this situation caught our local lawmakers off guard. I want to show you a letter sent from Governor Brown to Vice President Mike Pence on March 3rd. I'll read a bit of it to you right now. We are fortunate, she said, to have our own testing facility in the Portland metro area, which allows us to get results quickly and respond to those results immediately. Therefore, we are not requesting additional kits from the CDC at this time. Now, the governor has been asking recently for more tests, pretty aggressively too, but this shows that she thought 80 tests a day would be enough just 2 weeks ago. For comparison, Washington has 1,000 tests a day, and they don't have enough tests to test everyone either. Tomorrow, lawmakers are going to meet in Salem for an emergency COVID-19 subcommittee. Hopefully, some of my questions will come up. In the meantime, we're hoping to answer a few of yours about testing here in Oregon. Here's Kyle Aboshi.
The lack of widespread testing for the coronavirus has been a major frustration for health officials, physicians, and even the public. People showing symptoms want to know if they've got it. And today, Oregon Governor Kate Brown said soon there will be more tests.
We are expecting testing capacity to ramp up substantially in the next 3 weeks.
The governor said additional tests will be made available by a private provider and the federal government. The White House promised 1 million tests this week nationwide, followed by 2 million tests next week and 5 million tests in 3 weeks, although it's not clear how many will be allocated to Oregon. Which raises a few basic questions. Right now, how many people have been tested? As of Monday, 920 people have been tested for coronavirus in Oregon. That's nowhere near the 12,000 people tested in Washington or 2,300 tested in Minnesota. So why is Oregon lagging behind? The governors blamed the federal government for not providing enough test kits. And we don't have the same testing capacity as other states with numerous health labs or big universities. Right now, the Oregon State Public Health Lab is doing about 80 tests per day. So who is getting tested? Well, because of the limited supply, the state is rationing testing for certain groups. Doctors are told to limit testing to patients showing symptoms of coronavirus who are healthcare providers, residents of a high-risk site like a nursing home, and those at risk because of age or an underlying medical condition. But again, that may change as more tests become available. And how about those drive-through test sites? We see them on the news.
From Connecticut to Colorado, Ohio to Alabama, roughly a dozen states are now offering drive-through COVID-19 testing.
Governor Brown said it's something she's considering, assuming it's well planned out.
Obviously, I'm not very interested in people sitting in a 3-hour line. So we want to make sure we do this right.
Health officials hope more testing will lead to better surveillance for the disease. That means they'll know who's got it and maybe where it's headed next.
Okay, typically at the end of one of Kyle's pieces, we would be standing in the studio and chatting that way. But because a lot of our reporters are working remotely right now, Kyle has been filing his reports from home, and that's where he joins us right now. Kyle, thank you for the report. And also, I wanted to talk a little bit about some of the people you've been talking to who have tried to get testing and haven't been able to.
Yeah, I put a message out on Twitter, actually, saying, listen, I want to hear from people. I want to hear about their experiences. And I heard from quite a few people. They wanted to remain anonymous, which I totally get. But many of them said, listen, I'm showing symptoms or have shown symptoms. And that includes some older adults, also healthcare workers. And unfortunately, they're really frustrated because they're not able to get that test.
Are they anxious, nervous? Are they worried about spreading this? What are the concerns that they're telling you?
Right. Well, not only are they worried about their own well-being, but their family members. I spoke with one gentleman whose wife has a medical condition. He's worried about her well-being. If he has it, he doesn't want to expose her. So just having the peace of mind knowing, hey, whether I have it or not, that would really help a person like that.
All right, Kyle Aboshi, thank you. Of course, everybody at home, continue to reach out to Kyle. Talk to us here at The Story. Use the hashtag #HeyDan. We want your questions, your concerns, your stories. Tell us the things you're going through. Again, thanks to Kyle. From Kyle at home to Kristen in the studio. She's been answering your questions, the ones you're sending in using hashtag #HeyDan, though we should probably change it to hashtag #HeyKristen at this point. You've been answering a lot of them.
Hashtag #HeyChris.
I like it.
I like the sound of it. All right, no, these questions are great. So the first one, it says the grocery store was apocalyptic today. People are hoarding more than just the TP. Any concerns with the supply chain? Thank you, Stacey Brady, for that question. So according to all the major chains, no. the major retailer chains, you should not be, concerned with the supply chain. Now, you may go to a grocery store and notice some empty shelves. You may have to wait a day or two as they wait to get some product into their stores, but they say that,
it's going to show up eventually.
Exactly.
Got it. Okay.
All right. Next question. It says, hey, Dan, Walmart suddenly canceled my online delivery order with no explanation. It won't let me schedule another delivery or pick up any further. I want to know if this is permanent or what. So I called Walmart. They got back to me pretty quickly. They said, look, they had a big increase in orders. They had to cancel some of them because some of the products were not available. They said now customers should be able to order for same day or next day, but you can't schedule like a week in advance on this.
Got it.
And we know a lot of, Instacart, we tried to get Instacart the other day. Yeah, it's days. Yeah.
Sure.
All right. And our last question, should we take the plastic bag ban away to help keep people from contacting the Wuhan virus, as they bring bags into the store? So I asked a doctor about this today. He said it's safe to use your bags. If it's a cloth bag, wash it. If it's, a plastic bag, wipe it down. But he said you can use those reusable bags.
All right, good tips. Kristen, thank you so much. Keep those questions coming. Keep using the hashtag Hey Dan. You could start Hey Chris if you want, but Hey Dan works pretty well for now. Kristen, thank you.
You bet.
Now, during all of this uncertainty, hospitals, the one place you should be able to go and be taken care of, they're scrambling to be ready for a possible rush of patients because they don't have enough beds. Yesterday, Oregon health officials and the governor said they need to add 1,000 beds to the state's inventory. If you're wondering, is that a lot? 1,000? Well, for reference, Oregon has 6,000 beds up and running right now. A rep for Legacy Health said some hospitals do have space.
We know that within Legacy Health, every single one of our buildings actually has extra capacity under its current license that it doesn't typically utilize. So we have rooms and beds that are typically empty because on a day-to-day basis, we don't necessarily have the kind of volume that we need to have to fill those beds.
Okay, so I guess that feels a little bit comforting, but here's something that is not so comforting. A group called the Kaiser Family Foundation, they track the number of hospital beds per capita in each state, and the state with the least number of beds, you see it right there, it's Oregon, with 1.6 beds for every 1,000 people. Second to last, Washington, with 1.7. Now, the national average is 2.4. South Dakota has the most with 4.8. Oregon officials say our low number is actually a good sign. Most of the time, we basically are a pretty healthy state, but during a pandemic, this is really bad. Tomorrow, a special committee focused on fighting coronavirus in Salem will meet and discuss essentially what's next and what they plan to do. And it's looking and it is looking and more likely that what's next is a special session in Salem in the next week or two, as soon as they find a way to meet and maintain that safe social distance.
It kind of feels like this is the week where coronavirus really kicked into gear. But the crisis actually started last year. That's why they call it COVID-19 and not 20. So how did we get here? December 31st, 2019, New Year's Eve. While the world was celebrating the end of one year and the beginning of another, the World Health Organization learned about the very first cases of a mysterious virus causing pneumonia. A week later, on January 7th, 2020, China confirmed the virus is a novel or new form of coronavirus. On January 11th, authorities in Wuhan, China then announced the very first death, a 61-year-old man. January 16th, the virus appears outside of Chinese soil in Japan. Then on January 21st, the U.S. sees its first infection in Washington. 10 days later, on January 31st, President Trump denies entry to foreign nationals who traveled to China. Nearly a month after that, on February 26th, the U.S. saw its very first coronavirus case of unknown origin, suggesting community spread. 3 days later, the first American dies of coronavirus in Washington. And on March 9th, Italy completely shuts down its borders. On March 11th, things changed in the U.S. dramatically. The NBA postponed its season. Tom Hanks and Rita Wilson announced that they were infected. And the WHO officially called the virus a pandemic. The next day, the NCAA basketball tournament was canceled, and Governor Brown announced all Oregon schools were closing, the first of many closures to come in the following days. And that's the short version of how we got here.
Hey, real quick, I don't think I'm the only person who forgot that it was St. Patrick's Day until like halfway through the day today. And I know we all need to let our green hair down right now, and St. Patty's is usually the perfect excuse to do that. Now, I'm not telling you to drink your green beer at home alone, but don't forget, 10's a crowd nowadays, according to the CDC.
So instead of tapping a keg, maybe you can stay in for a movie. Watch one of those great flicks inspired by the holiday, like Look, there are no good St. Patrick's Day movies, okay? Boondock Saints, right? It's not very family friendly, but it's a good one. Point is, I know you're probably desperate to go out tonight of all nights, but by staying in, you're not just keeping yourself safe, you're keeping other people safe and their family safe if you're unknowingly carrying the virus. Now more than ever, we have to look out for one another. We just have to. Don't worry, even if you have to hang up your green St. Patrick's Day hat tonight, you're going to have plenty more to celebrate in the future. Listen, we don't want to give you something else to worry about, but let's just say getting one of those real IDs by October is looking a lot less likely. And we have a resource for you now for the thousands of people facing job loss at the worst possible time. When the story continues. Welcome back. Thank you so much to everybody writing in using that hashtag HeyDan, letting us know what you're thinking, your questions. We read every single one of them. Hey, so do you remember we've been talking about how getting a real ID here in Oregon is going to be a real big mess? Well, how do you feel about it now? I can tell you how Representative Peter DeFazio feels because he brings us to tonight's quote of the day. Says creating lines at departments of motor vehicles would be foolish during a pandemic. Amen, Congressman. Couldn't have said it better myself. Remember, this October, we're all supposed to get those new ID cards in order to fly. But if you lived in Oregon, you wouldn't be able to do that until at least July anyway. We'd be the last state to be able to get it done. But now DeFazio and two other Democrats are urging the Department of Homeland Security to delay that October 1st deadline because of all of the coronavirus chaos. They say for implementation to go smoothly, DHS would need to tens of millions of Americans to get new identification over the next several months. Now, that doesn't sound like safe social distancing to me. Hey, here's something that we think is worth your time. The Oregonian has a great story right now on what to do if you've lost your job because of the outbreak. A lot of layoffs happened yesterday when those restaurants shut down across the state. So what can you do? Well, you can file for unemployment benefits if you think your layoff is temporary. If you're trying to get a new job, the good news there is that some people are still hiring, like Amazon and grocery stores. They do need people to restock all those shelves because people are still out there hoarding hand sanitizer and toilet paper.
Hey everybody, I'm Matt Safino. Now Dan, I know you said you forgot about St. Patrick's Day, as I'm sure many people did with everything that's going on until halfway through the day, but you know who did not forget about St. Patrick's Day? The astronauts on the International Space Station. That is the Irish flag floating around in front of the window looking out at what looks like Earth in the distance there. This is about 250 miles or so up in space. They also did a flyby of Ireland and shot this picture for us from the International Space Station of the Irish Isle looking quite green on St. Patrick's Day. So again, there you have it, the International Space Station providing us a little St. Patrick's Day relief here. All right, let's check out our situation. We had a clear sky, but then the clouds rolled on in. High clouds over the valley, low clouds along the coast. Clouds are clouds, right? But it matters because the low clouds are going to clear tomorrow afternoon. We hit 61 today. See all the green on the map? Again, we're doing the St. Patrick's Day thing, even if you're not. 63 in Eugene, 62 up in Kelso. All right, again with the green. There's a little bit of rain off the coast. That's the radar, right? But that's moving away. There's not much. We won't get any rain out of this system at all as things will be improving as we go through the day tomorrow. And then after that moves out, there's a bunch of high pressure that moves in for a really great stretch of weather. So this is Futurecast showing the rain moving away. We're dry on Thursday. We're dry on Friday. Saturday looks like the warmest day, and we're still dry on Sunday. And if we manage to pull that off, that'll be a feat we have not accomplished in Portland, both weekend days being totally dry since early November. That's 19 weekends. 19 weekends. So hopefully we get through Sunday before the rain arrives, because it certainly will arrive on Monday and Tuesday. And in fact, it looks like a pretty wet pattern going forward once we get into next week. But the next 5 days, tomorrow through Sunday, look fantastic. It's 59 in Portland right now with the cloud cover. You know what? It's not really doing much. It's going to keep our morning temperatures a little bit warmer than they've been with the clear sky the last few nights. So on the coast, partly sunny. After morning fog, we'll see highs there in the 50s. In the valleys, we'll have morning clouds. Then it becomes partly to mostly sunny. Highs will be in the mid to upper 50s or near 60 degrees. Up in the Cascades, partly sunny as well, and about 43 at Government Camp, so that's not bad. Warming up in the mountains a bit too. Central and eastern Oregon, a morning snow shower, especially down south, but otherwise the sun begins to come out. In the Gorge, we had east winds the last couple days. They're gone. West winds tomorrow, but only 5 to 20 miles an hour and becoming sunny after some morning frost. So again, a little bit cold in the Gorge. For Portland, a high of 58 tomorrow. Clouds in the morning, sun in the afternoon. And again, look at this 7-day forecast. Spring begins Thursday with great weather. 62, then 63 Friday, 64 Saturday. Still good Sunday. Then here come those spring showers as we go into next week. Dan, back to you.
Something to smile about there. Hey, and thanks for showing us that stuff from the astronauts. At least things are still normal in space.
Yeah, that's kind of fun.
Yeah, Matt, thank you. Hey,
Sure.
Tonight on The Story, we're starting a new segment called In Other News. That means any news that we can find that doesn't have to do specifically with the coronavirus. And let me tell you, right now those stories are kind of few and far between, but we don't want to miss anything important, so here we go. First up, norovirus. Yeah, I know, another virus, but we haven't talked about this one in a while. And there's a big recall right now for frozen berries that might be contaminated with it. So they're sold at Winco stores. Keep that in mind in a few states, including Oregon and Washington. So if you have a few in the freezer, maybe go ahead and throw them out. Now, we've been talking a lot tonight about the lack of coronavirus testing here in Oregon. Well, one thing that's finally getting tested are rape kits. You might remember there was a huge backlog of untested kits for years and years here in Oregon. Well, they finally got through all of those kits, and now people are getting arrested and convicted. A Portland man just got sentenced to 15 years in prison for raping a woman back in 2007. He's the 7th person convicted in Multnomah County after they started testing these old kits. And the last thing we're going to tell you about has to do with a hospital. And again, it's not related to the coronavirus. The largest healthcare provider in Central Oregon is being sued for sexual discrimination. A former pharmacist claims that St. Charles Health System is an old boys club with a sexually hostile work environment. She says she had to put up with sexual comments and jokes and had to watch videos of nude women. She says she then got fired for reporting all of this. The hospital says they're looking over the lawsuit with their lawyers. And that's in other news. Hey, keep those questions rolling in using that hashtag #HeyDan. We've been reading all of them, and we're doing our best to find you some answers. We're going to have some comments and read those after the break when we finish the story. Welcome back. Let's read some of your comments. People writing in, emailing us, hitting us up on Twitter using hashtag #HeyDan. We're going to start with Don Dillashaw. He says, hey, Dan, so does your reporting mean that right now, today, the entire state of Oregon is only testing 80 people per day? No, that's not what I'm saying. We're only testing 40 people a day because each person gets 2 tests. So it's 80 tests, only 40 people in the entire state of Oregon every single day. That's why we keep doing this reporting. I want to know more why that number doesn't feel right to me. It doesn't feel right to you. So we'll keep asking questions. Terry writing in and saying, my suggestion is to begin preparing the Wapato jail for patients or as a testing site, something like that. Wouldn't it be amazing after everything the Wapato jail has gone through over the years if it finally started helping us and helping out during this situation? If you're curious what Wapato is or what it's been through, we have a video for you on our YouTube channel. You should go ahead and check it out. And Kelly Harris saying, no Irish movies? Hey, Dan, what about Darby O'Gill in The Little People, Disney classics? I've never heard of either. Are you making those? Those sound made up to me. Look, I'm going to do some Googling. I'll get back to you. In the meantime, thanks for being with us here on The Story.